Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist working in UK. And this morning with me today is Dr. Francis Ledesma, who is an IMG from Philippines who came to UK in 2018. And the reason we are doing this interview is about her experience of securing the core surgical training. I think a lot of IMGs are interested in surgery, and they ask a lot of questions about, how to go about it. And sometimes they get negative feedback that it's not possible for
Mm.
IMGs. So I think it's very important for us to hear from a successful IMG. So we are recording this interview in the April of 2021, and Dr. Francis will be starting her core surgical training from the August of 2021. So first of all, congratulations, Francis. I mean,
Thank
that is an
you.
amazing achievement. So if I ask you the first question around, if you don't mind taking us through your journey as an IMG in UK, how did you come about here and what have you done so far?
Sure. I graduated from the Philippines in 2017, and the way our system works back home is that you have to finish your clerkship and internship. So that's your FY1, FY2 equivalency. And I took my licensing exam back home, finished that in September 2017, I think. And then I immediately started preparing for PLAB. So I finished PLAB by February 2018. And then I started applying for jobs. I think I applied for every job possible, I
Yeah.
think. A&E, surgery, anything really that would just get my foot in the door, essentially. And then I finally got a few offers, and I took the surgical SHO post at TGH and started in October 2018. And since then, I've worked at least, I would say, 16 months in surgery at a TGH and at a major tertiary hospital, and then switched to intensive care. And unfortunately, this coincided with the pandemic. But it was also to make sure that I didn't breach my 18-month limit for core.
Uh, so, um, uh, so were you always thinking about surgery, or was it something that you thought about when you came to UK and worked in surgery?
I always thought I was going to end up in a surgical career. Um, During my internship and clerkship years, I was very much adept at the surgical skills and thought this specialty would be well suited for me. I like the motor skills. I like the idea of being in theaters and all of that. So I had already considered going into surgery by the time I started applying for jobs here.
The 18 months you mentioned, I think it's very good to clarify to the IMGs that what it
Mm.
means.
So for applications to core surgery training, there is a rule that you cannot breach over 18 months of surgical training, but this only includes surgical experience after your FY2 or your internship. So anything after that, the clock kind of starts. So when I accepted the offer as a surgical SHO, that's when my clock started because that was my first surgical job post internship.
So it means that just to elaborate more, it means that you cannot apply for core surgical training if you've done more than 18 months, but you can do your MRCS and go for the ST
Yes.
training. That would be your route then.
Yes,
Okay.
definitely. But then I would give a warning to people who are applying also for SD3 is that they're very strict now about the number of surgical experience, the amount of surgical experience you have. Usually they don't take anyone who's had more than 3 or 4 years of surgical experience. So if you're applying for SD3, I would be wary of the limit also.
Okay. So if you take us through your experience of applying for the surgery, and how did you make your portfolio, and then we will talk about the recruitment process itself. But how did you made your portfolio for this?
I started with downloading the person's specification as well as the self-assessment form of the previous year and making sure I could maximize as much points as I could in every domain. So for teaching, I tried to get involved with the local teaching in my hospital. I also started teaching at one of the universities. For medical students, for qualifications, I took up a master's. So it's just maximizing everything you can in the portfolio, closing the audit loops, presenting in an international conference. And those things are the ones that will get you the points to get shortlisted.
And what was the recruitment process like for you?
I think this year was challenging for everyone because everything became virtual all of a sudden. So the long listing process at first was a bit rocky because initially they had tried to disqualify me, saying that I had more than 18 months, when in fact it was an error. So it's always good to be careful about these things and making sure that the dates that you input are very clear, that you are actually not breaching that 18-month rule. Once they had corrected that error, it was just a matter of making sure I got all the points, which they confirmed. I think they had tried to downscore everyone. They had downscored me by about 5 points, I think. And of course, there's an appeals process to kind of clarify why you scored yourself that way in the first place. And so they took a lot of those into consideration also. And then towards the end of long listing, I ended up with about 52 points.
And does this application, just to explain to the IMGs, this starts from when did you actually apply for CST? Was this in the October,
It was
November
in
time?
November 2019, 2020, sorry, November
2020,
2020. Yeah, just
2020.
last year.
So this year it will be expected to start at the same time, so
Yeah.
that date, that month or date is sort of important for people to realize, because that's where their application will go in.
Mhm.
And what was what was the recruitment process after long listing? Once you were long listed, you had all your marks and your criteria seen. Then what happened after that?
You get scheduled for an interview for as long as your points met the criteria still after the downscoring or upscoring and evidence confirmation. And I'd like to make it clear to everyone also to be very specific about the evidence they upload or they present, because they only accept official letterheads, they only accept actual proofs, as they would like to say. They were careful not to accept a lot of reflection papers this year, just because they weren't sure how to confirm it with the hospital. So always make it clear using official letterhead as much as possible with regards to what kind of proof you're asking for. And you have to outline that, I was a leader during this period, from this period, things like that. It's always important to do that. But I was invited for an interview, and this year the interviews took place online. It was 20 minutes this year instead of 30 minutes last year, because they cut out the portfolio section now, considering that they had already gone through it during the long listing process. And so this year there were 4 stations. One was a leadership station, which they usually give you a topic that you get 3 minutes to prepare for beforehand. They usually send it to you about 2 weeks before the interviews, and you make a statement about it, and they'll get another 2 minutes to ask you questions about your leadership statement. The second one, 5 minutes of a management station, which most of them will usually come from the ISC medical interview textbook. And then there's 2 stations of clinical scenarios, 5 minutes each.
All right. And how did you find it? Was it so intensive, or do you think that is something that you should practice prior to going to interviews?
I think you definitely need to practice your leadership statement.
Yeah.
Make sure that it sounds smooth. Make sure that you're answering all the questions that they ask in the presentation. If they're asking for a reflection, give a reflection. Don't just give a situation. And make sure that you time it perfectly in that 3 minutes, that you are able to say everything you need to say. So I spent about a week memorizing the statement that I was going to give. And I think that was really helpful because that made it sound like I was practiced enough to sound natural, but not over rehearsed. So you need to be able to convey the fact that, everything you're saying is coming naturally. And I think that's difficult if you're not practicing it enough. So it's a balance between practicing and not over rehearsing things. And I think the clinical scenarios are very much, they follow the clinical scenarios are usually based on 2 things, your ATLS protocol and your CRISP protocol. So you can Google those online. They give you a very good guide as to how to approach a patient in those 2 kinds of scenarios. And if you're able to get it down, I
Mm.
think you should have no problem.
Okay. So if you have IMGs, I think we'll talk about medical students first. If there are some medical students, they are fourth or final year of their medical school, thinking about becoming surgeons and thinking about doing core surgical training in UK, have you got any advice for them that what they should be doing now, or how can they sort of make sure that they maximize their chances?
I think what they should be doing now is again just building their portfolio. If they can take leadership opportunities in school, that would reflect well also. That would give them points. Having published papers also while in med school or research in med school, I think that definitely helps. So I think you can start working towards it as long as you're absolutely sure this is what you want, and it's very easy enough to know how much to go for because they give you a guide anyway in the self-assessment form.
And if there are any junior doctors or any IMGs currently working in UK and thinking about core surgical training, um, I think this is the time. It's only the next recruitment round is only for 5 or 6 months left, and they'll
Yeah,
restart it. So what should they be doing now? What should be their priorities right now?
I think the priority right now is to make sure that get any publication you can as much as possible. You have 5, 6 months to do it. Submit your publications for abstracts also so that you can present. This is achievable within 6 months. Make sure you do audits, close your loop at least twice, and present that even if it's at a local hospital, and get involved in your local hospital teaching also. So you're able to still maximize the points within 5 to 6 months. I did it last year. I was working towards building my portfolio around this time also in February, and I was able to get everything done. It's always important to know that you need everything done. So you must have presented, submitted everything by the time applications open because they won't consider things like things that were meant to be presented in December
Mm.
of this year. So make sure everything is done and checked. All the courses that you think you can take that are surgical related, I would suggest those also. It's easy enough to look for surgical related courses on the RCS website. So that should be helpful as well.
Thank you very much for joining me and giving us insight into how you went about securing your core surgical training and all your advice you've given to the IMGs. I'm sure this will be very useful for the next generation when they're doing so. I'd like to thank you again for this,
Sure.
giving us your time.
Thank you.